This is Caring for Kids on News Talk 760 WJR, presented by the Children's Hospital of Michigan Foundation. And here's your host, President and CEO of the Children's Hospital of Michigan Foundation, Larry Burns.
And tonight we're going to discuss a variety of issues concerning the health and wellness of children locally, regionally, and nationally. We have President and CEO of the Catholic Foundation of Michigan, Angela Moloney. Dr. Dennis Martell, he's the Director of Health Promotion at Michigan State University, and thoracic and pediatric cardiac surgeon at Children's Hospital of Michigan, Dr. John Dentel. It's all coming up next right here on Caring for Kids on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Thank you, Mark. Larry Burns here for Caring for Kids. And in the studio, we have Angela Moloney. Angela Moloney is the President and CEO of the Catholic Foundation of Michigan, a position that she has held since May of 2017. Through her work at the Catholic Foundation of Michigan, Angela is committed to increasing the impact of Catholic ministries, parishes, and schools by inspiring charitable giving and managing assets to grow the church long term. Angela has served Catholic organizations for nearly 20 years, providing direction and advancement, administration, cultivating donors, leading teams, fostering strong networks, and implementing policies to improve philanthropic giving. Prior to this, as President and CEO, Angela most recently served as Domestic Director of the Jesuit Volunteer Corps, a Catholic organization connecting young volunteers with opportunities to serve marginalized communities. Angela obtained a Master of Arts degree in theology from Washington Theological Union and completed a nonprofit management executive certificate program from Georgetown University. She graduated from Madonna University in 1997 with a Bachelor of Arts degree in Pastoral Studies and Counseling. Angela, welcome to Caring for Kids.
Thanks, Larry. It's great to be here.
It's great to see you, and that's a lot of great stuff that you've been involved in. And we have an emerging relationship with Madonna University. My former colleague, Cam Cruikshank, is one of their leaders there, and we're developing some things there, so hopefully that will continue. So you and I met a little while ago, and as our foundation sort of continues down this path as a community foundation for children, I wanted to meet you, in essence, a community foundation for the Catholic Church and the Catholic organization. So tell our listeners a little bit more about the Catholic Foundation.
Sure. So the Catholic Foundation is really an inspiration from laymen and women in the Archdiocese who had the desire to support philanthropic giving. Our ministry and mission is really twofold. It's first to support individuals by providing for them really personalized philanthropic services, so donor-advised funds, scholarship opportunities, endowment opportunities, as well as supporting vital ministries, parishes, schools, nonprofits who are doing good works to make sure that they have the resources and the training and the competency to do good work and have philanthropic resources at their disposal.
And so this is relatively new to our area. Is it pretty prevalent around the country of Catholic foundations in other states and other communities?
There's about 120, 150 Catholic foundations around the country. Some are specific to an archdiocese or linked to a diocese. Ours is really unique in that we're completely separate from the Archdiocese of Detroit, endorsed by the Archbishop, but a separate, transparent, completely different entity altogether.
Okay, good. So that makes you unique in some ways. And so what is it that over the last year or so that you feel that you've been surprised at, or some of the things that you want our listeners to know in this little over a year journey?
It's been such a grace-filled journey. I'm not surprised by the generosity of Detroit and this area at all, but some of the specific intentions that are out there are really inspiring and impressive. We've had one person in particular who came to us and said, I want to honor my mom and my aunt for the amazing work that they did raising us, and created 4 scholarships at their elementary school in order to send kids to school who wouldn't necessarily have an opportunity for a Catholic education. So that's just one example of an individual who came forward. We're in the process now of granting. We have a grant.
Yeah, that's what I wanted to ask about next.
Yeah.
Is this the first process of granting?
This is the first process. We do donor-directed grants, and we've contributed about $700,000 just this first year in donor-directed giving. But our competitive grant process, this year we've had about 60 organizations apply for the competitive grants, and we'll be granting 25 of them at $90,000 the next month.
Oh, wonderful. So we'll have to get you back on and let our listeners know what organizations receive grants. And we're talking with President and CEO of the Catholic Foundation of Michigan, Angela Moloney. And so how do people find out more about maybe either starting a restricted fund, a donor-advised fund, or getting involved with the Catholic Foundation?
It's real easy. They could visit our website, which is www.catholicfoundationmichigan.org. They could give us a call. They could approach their pastor at a church and learn more.
Good. And how are you getting the word out? It's something that we're working at the Children's Hospital Michigan Foundation all the time, of getting the word out that people can use our foundation, much like they can use yours, to support, in our case, children and young adult organizations across the region, across the state, or maybe even the country. And so we have shows like this, Caring for Kids, and how are you trying to get the word out to the Catholic community?
We're working with partners like yourself in order to do that, working with the bishops and the archbishop in order to really help parishes learn about this option, and we're also working with a variety of networks, of Catholic networks as well. There's a young adult Catholic professional group that we're working with.
I'm familiar with them. I'm not young, but I'm Catholic. But I've seen some announcements regarding their activities.
Our hope is to really start educating, in particular, young adults, families as well, but helping them understand the value and the importance of giving. We know that there's going to be a shift in how young adults and millennials give, and really wanting to help make sure that they're educated in doing that. So we're partnering with young adult groups as well.
Excellent. Well, I was very impressed over the last week or so with the Archdiocese campaign that involves daily messages via the texting or the website or whatever, in trying to engage not only all Catholics, but in particular trying to reach out to younger Catholics and trying to get them to spread the word about, in this case, the gospel. And I saw that as very innovative. And are those things that you try to stay aware of so that you can complement them as well?
Indeed. The hope is that our messaging can really be together and connected. Our job is to really support the work of the Archdiocese while we're separate from the Archdiocese. And so a good collaboration is definitely involved, and we have a strong partnership with the marketing and the communications team at the Archdiocese as well.
Yeah, so I was very impressed with that, and also impressed recently, being Catholic, of just the frankness that my wife and I attend St. Ambrose most of the time, the frankness of some of the letters in the bulletin about how to engage the millennial Catholics and try to get them involved or back involved, and so I admire the fact that they're addressing things pretty openly and trying to change.
Right.
And so where do you see the Catholic Foundation in maybe 5-10 years?
Oh, goodness. So many options and so many opportunities for growth. We really want to serve at the center of Catholic philanthropy and be present to Catholics and non-Catholics alike who want to have their investments in line with their values. And so all of our investments are in line with socially and morally responsible investment guidelines, and that's really what makes us unique. And so ideally we would have an endowment at every parish, at every Catholic school, would be endowed, because Catholics haven't been very good about that long-term planning for our parishes and for our schools. And so making sure that there's not a fear that they're going to simply go away because funding might shift or dry up in some instances. And so funding there, as well as a real support for discernment for families and for young adults, helping them grow and learn how to be good and conscientious and informed givers. When you become informed, you can give in a better and more impactful way. And so we really want to help form givers in that way. And then we intend to be here in the long term and to grow and to continue to be of service in a more impactful way, giving away more funds, supporting more families.
Great. Well, you're off to a great start, and I have no doubt that in 5 years that you'll even be stronger and more evident of what's going on in the Catholic community. So, and I hope to partner with you on some either granting things that are helping our community. We have a nice relationship with the Jewish Federation. We're developing a relationship with the Chaldean Community Foundation, which I'm learning there's many Catholics within that community. And so even though we're not affiliated with any religion, we're affiliated with organizations that help kids and their families. And so I look forward to partnering with the Catholic Foundation in the future.
Well, thank you for all of your excellent work, and
thank you.
Look forward to partnering as well.
Great. So that's Angela Moloney from the Catholic Foundation of Michigan. And coming up next, we're going to hear from Dr. Dennis Martell. Dennis is the Director of Health Promotion at Michigan State University. And that's when Caring for Kids continues right here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Hospital of Michigan Foundation.
Dr. Dennis Martell is the Director of Health Promotion at Michigan State University. In his role, Dr. Martell is focusing on collaborating more with other on-campus health services in order to address the needs of the community, expand reach to touching more students, and developing more data-driven opportunities for maintaining health. Dr. Martell earned his bachelor's degree from Northern Michigan University, a master's degree from Central Michigan University, my alma mater, along with another master's degree and PhD from Michigan State University. He has all the universities covered. Dr. Martell, welcome to the studio, welcome to Detroit, and welcome to Caring for Kids.
Thank you. It's a pleasure to be here, Larry. And I have traveled the state, and one of the aspects of going to Northern Michigan University was my classmate and study person was Tom Izzo.
Really?
Along with Steve Mariucci. Steve Mariucci, Mooch, and Tom Izzo were my study mates. So.
Did you help them get through the hard things?
Oh, I tried my best. I really tried my best.
Yeah, well, they went on to some very successful things. And I remember then... we were probably in school near the same time because I remember Steve Mariucci when he was quarterback for Northern.
Absolutely.
And I believe they won a national championship in the division they were in, right?
I was the athletic trainer for that year.
Really?
And I left through the season because I was focusing more on my academics, but that's where I met Steve Mariucci, and Tom is through the athletics department.
And now you're at Michigan State, and Coach Izzo is as well. So.
And it was funny because one day I was just walking down the path, and Tom Izzo was walking with Judd Heathcote, and I looked at Tom, and he looked at me, he said, "Dennis." I said, "Tom, boy, we're at the same place now." So
how cool is that?
It's been cool.
Yeah, that is great. So tell our listeners a little bit about the health promotion department at MSU and some of the things that as the department you kind of prioritize on.
Well, our health promotion department is not like the old health education departments that back in the 70s and 80s would talk just about doing education. Yeah. Our health promotion department is about promoting the concept of health. Now, I define health much differently than most people. I say health is the capacity that you have at any given moment to be in this world, to relate to this world, and to give back. So what we do is promote the capacity of students to be successful, whether it's mental health, whether it's physical health, environmental health, religious
health. A holistic approach.
Holistic approach. It's really about capacity. So what we try to do is remove the barriers to students being academically successful. So we're all about research. Many of the things that the foundation is for, research, outreach, innovative approaches, and direct contact with students. We believe we need to engage with students because we don't know what's happened to them for the first 17 years before they get here.
Exactly.
So we try to connect with them as much as possible, and we do a lot of research. So my department oversees alcohol, tobacco, and other drugs, human sexuality, fitness, nutritional education, and several other aspects of of health on campus. And I am the director of that, but I'm also the executive director of the National Social Norms Center, which is a foundation grant from the Anheuser-Busch Foundation.
Okay.
And what we're trying to do is find better ways to use a product that doesn't necessarily cause harm and really talk to students about the protective behaviors. So we oversee all that.
That's a lot. And we were up at MSU meeting with some of your colleagues recently, and unfortunately you were not there. Your father passed. We're sorry about that. And just so impressed with the innovative things that MSU is doing. I spent 27 years in higher ed at the University of Toledo and some time at the University of Akron, so I know the issues, the things that students deal with, and then the responsibility that university administrators feel. And so, boy, I really admire where you're going and what you're doing. And let's talk a little bit about some of the, I want to go right to some of the trends that you're seeing in these students versus maybe when you and I went to northern and central Michigan. And so I know our listeners are really interested in the things you're seeing, and then you can talk about what you maybe want to do with that.
You know, one of the hallmarks of our program is doing extensive research. We now have 20 years of data on students. We're tracking 42 different health issues and how they impact students and how they get these health issues and how we can try to remove them. So we have like 42 different issues. The positive trends we're seeing over the last 20 years, we've seen the amount of students choosing not to drink and not to use drugs. We hear a lot about, the opioid epidemic and marijuana use, and now we have this the new passing of the proposal, and we're trying to educate about that too. But we've seen a reduction from now it's around 26% of students at MSU don't even choose to drink. Now that's their choice. We've also seen trends in students wanting to actually sleep more. Sleep is not one of your really passionate, sexy topics to talk to students about. And it's even worse talking to adults. I mean, when I ask parents who come to MSU how much sleep you got last night, they say, well, I got 5 or 6. And I've got, you cannot not sleep. You have to get 8 hours. Well, I can catch up on that. Sleep doesn't. You don't catch up on sleep. So, but some of the trends that are more challenging is in the area of mental health.
Yes, that's what I thought.
We're very concerned about that. We've seen increases in students with depression, and we didn't even track anxiety up until about 6 years ago. We always just put it in with stress. But anxiety has shown itself to be even more debilitating in impacting academics than even stress or depression. If you come to MSU and you're already been diagnosed with depression, the chances that it's going to impact your academics, the probability is 50%. So if we don't have support systems for those students when they get here, they're not going to be as successful as we want them to be. So the trend in mental health has been really disconcerting. The other trend we've been seeing is students who are homeless and students who have food insecurity. We have one of the first programs in the nation. We are now celebrating our 25th anniversary of having the first food bank in the nation that...
For 25 years.
25 years, back when it was not even thought of that a student wouldn't have the resources. So food insecurity. We have about 13% of our students who do not have the resources to make their next meal for themselves or their families. So we're providing supplemental food for these students, the basic necessities that a student needs, because my wife is a middle school teacher, and every weekend we go to Sam's Club or somewhere else and we buy a bunch of snacks. And I always ask my wife, so why are you buying snacks? She said, the biggest distraction to learning is somebody who is hungry. And so we'd buy, snacks for the kids because many of the kids didn't have...
They're not getting it somewhere else.
Yeah,
so we're talking with Dr. Dennis Martell, Director of Health Promotion at Michigan State University, about the great programs and the many programs that he's involved in. And so the mental health issue, that's something our foundation is getting very involved in. We were up at MSU visiting, as you know, because we want to develop some partnerships with you and your colleagues. And one of the things that I think we're making progress in, and I'd like your opinion, is that it appears that the generation of college students now are a bit more at ease mentioning that they might have depression or that they might have some issues versus hiding it with the stigma that I grew up with.
We're trying to remove that stigma. We're trying to improve help-seeking behaviors. We want students. We try to normalize it. And that's what we're doing with the Social Norm Center, too. If we put out the message that, we do the research on students saying, do you approve of using the counseling center? Do you support people who have, depression? And if you get 90% of MSU students who say, I support going to the counseling center, that helps remove the stigma.
Sure.
That helps those students who do have depression to go and seek help. We're not necessarily sure we have all the resources to meet that need, because we have probably students who are waiting for some time to get in to see counselors and psychiatrists.
Yeah, and when we visited, we had the opportunity to talk to some folks who run the clinic that's and one of the things they said that really surprised me, that they might get 40 walk-ins a day of students who kind of self-describe themselves as having some issues, and I'm concerned that there's 40 a day, but it's hopeful that at least they're going to look for help.
They're looking for help. I've been at MSU for 33 years, and I've seen the evolution of the student. I've seen changes in the student. I think the student that we have nowadays, as we were talking before the show, that are very distracted by technology, and we call it distracted living, because they don't necessarily have the sense of the environment around them to actually make really good decisions about getting help. We do. 40 students per day is really nothing.
Right.
Coming into MSU or any university.
Yeah.
My alma mater at Central, I'm in contact with them, or U of M. They're all facing the same types of problems. They're all students are asking for help, and they're presenting themselves with everything from, I just broke up with my roommate, I don't know how to deal with, to I have suicidal ideations.
Right.
And those are very concerning. And right now, it was just released this week that we are the first university in the state of Michigan to supply recovery housing for students who are in recovery.
Yes, I'm so impressed with that.
We found that there are probably 1,200 students at MSU that need support for
1,200
for recovery, and there's a lot of students willing to go to a university that has a support system. So we now have housing at MSU supported by professionals and different things to help those students be really academically successful. And we've seen with the research that these are some of the most academically successful students if they have the support.
If they have the support, and they know how to get the support, and they're willing to find that. So, Dr. Martell, thank you very much. We're going to have you back on once we determine what our partnership's going to be. Because we're very committed to the college-age student. We've expanded our view of what a child is to young adults, and particularly in mental health. And so I want to let our listeners know that I have firsthand seen what Michigan State is doing, and this is a university that if your child or family member goes there are services to make sure that they're supported. So I commend you for all that.
And I want to thank you, because doing research on the foundation, I am so impressed with the different activities you are funding. And as I said, your foundational words were innovative, research and education, and I just commend you for the work you're doing.
Thank you very much. And more to come in that. Looking forward to it. Go Spartans. That was Dr. Dennis Martell, Director of Health Promotion at MSU. And coming up next, we'll hear from thoracic and pediatric surgeon at the Children's Hospital of Michigan, Dr. John Dentel, when Caring for Kids continues right here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR. Presented by the Children's Hospital of Michigan Foundation. Once again, here's Larry Burns.
And in the studio, we have Dr. John Dentel from Children's Hospital. Dr. Dentel is a thoracic and pediatric cardiac surgeon at Children's Hospital of Michigan. Dr. Dentel received his medical degree from Wayne State University while completing his general surgery residency at the Yale University School of Medicine. Dr. Dentel also completed 2 fellowships, one in cardiothoracic surgery at the University of Indiana and the other in congenital cardiac surgery at Seattle Children's Hospital. Dr. Dentel, welcome to Caring for Kids.
Thank you. Welcome. Thank you for having me today.
We're delighted that you're here, and even more so, we're delighted that you're at Children's Hospital in Michigan.
Thank you.
And how long have you been at Children's?
3 months.
3 months. That is awesome. But you went to school at Wayne State, so I'm sure you're very familiar with. We're very familiar with Children's Hospital, and so tell our listeners a little bit about your role at Children's Hospital and some of the things that you're doing now and that you hope to accomplish in the near and the not so near future.
Yeah, I think one thing that people may not understand is that as a congenital heart surgeon, not only do we operate on all patients that have congenital heart disease, so they're born with some sort of defect or diagnosis.
Right.
So those patients may be a couple hours old, so newborn, or it may be a patient that may be 50 or 60 years old. And we follow those patients really from birth until the end. We are specialized in dealing with those patients and taking care of those patients. So it's really a privilege to operate on such a wide range of patients. And just following those. And really it's really in the training that I've had along the way and noticing the relationships that the other surgeons form with these patients.
Right.
So it's nice to have a little bit of primary care side of it.
Sure.
Because, I may operate on a baby that's a newborn and operate on them again when they're 6 months old and then 4 years old, and they may need other operations down the road, and you're kind of that stable physician for them.
Yes, and is it also accurate to say that in your specialty that because of the fact that you've been following this patient since maybe they were a newborn, that even when they're maybe 20, that you're still following them and providing guidance and service to them as well?
Exactly, and we do it in close relationship with our cardiologists.
Okay.
A lot of these patients may not come necessarily from the Detroit metro area. They may come from, northern Michigan, mid-Michigan, southern Michigan, even patients from Ohio may come.
Sure.
And it's really because there's only a few centers that do this. So we're really specialized and really depend on those cardiologists to help us and follow those patients.
And we're talking with Dr. John Dentel, thoracic and pediatric surgeon for Children's Hospital in Michigan. And one of the other things I love to ask our physician leaders from Children's Hospital is what makes the Children's Hospital of Michigan special, and what do parents and grandparents need to know about a dedicated pediatric hospital versus a community-based hospital?
Yeah, I really think it's a subspecialist. We have, for us and our team, we have anesthesiologists that are pediatric trained in fellowships. We have some that have done special training in pediatric cardiac training.
Right. We
have intensivists that have all done cardiac. Some that have done cardiac training, some that do PICU training, and the same thing with our cardiologists. So everyone is pediatric trained at some level. And then also on top of that, the resources that are available. The resources as far as what an adult needs are going to be different than what a child needs. And we have all those resources available at Children's.
One of the things I learned early on, because I worked at Children's at the beginning of my career and then had the opportunity to come back now, is that children aren't little adults. And so you mentioned all of those specialists, including nurses, that are trained to deal with children and not adults. And so that's also important, correct?
It is, and it's interesting because you're treating the whole family. And sometimes you're trying to help the parents understand what's going on, but also taking care of the child. And the nurses, the folks that are at the bedside, really have to balance that. And it's important for them to teach the parents what's going on, as well as taking care of the child at the same time. And a lot of our babies are pretty sick.
Yeah, they are. The other thing that regarding the family is the community may know that Children's Hospital of Michigan just cut a ribbon a little while ago on the new lobby and tower. $150 million investment into the hospital, making it even more state-of-the-art than it was. And the lobby is welcoming. It's not a hospital-type lobby. It makes families and kids feel more welcome and comfortable. And our foundation is in the process of making that even better, and we're going to have a new interactive wall there for kids to play with, and so by the time they see you, maybe they're a little bit more relaxed. And
No, yeah, I think I'm going to piggyback on that a little bit. We actually have a brand new operating room, state of the art, that we are able to have enough space for all the equipment that we need. We need perfusionists for our heart-lung machine to do our operations, and that takes up a lot of space. And then we also have a dedicated cardiac intensive care unit that's kind of a step off from the PICU, so that we have our patients all in one place, so that our team can focus on our patients.
That's very, very important. And as I mentioned, we're talking with Dr. John Dentel, thoracic and pediatric surgeon at our Children's Hospital of Michigan. And so we also have a lot of listeners that want to know how you found this journey of where you ended up. Is this something you thought about as a young man, and what led you to the specialty that you chose?
I was definitely younger than a young man when I got to this point. I remember vividly going to my pediatrician when I was about 3 or 4 years old.
Oh, come on.
Oh, yeah. And I remember Dr. Rao in Jackson, Michigan. And I actually had to call them a few months ago to get some old records. Mm-hmm. And I told him what I did.
Right.
And I said, make sure you tell Dr. Rao. And I had to call back, and they said, we told him, and he was so excited for you.
Wow, you knew that early on.
That I wanted to be a doctor.
Okay, and we mentioned that you went to Wayne State University.
Yeah.
Where did you go to undergrad?
Michigan State.
Michigan State. So
Yeah.
you're Spartan. And on our show tonight, we have a Michigan State person as well that's dealing with the health of the students at MSU. So that's extremely important as well. And what else do you want our listeners to know about research at a children's hospital, and in particular how research might impact what you're able to do for your patients now and maybe in the immediate future?
Yeah, so one thing that I was really exposed to in Seattle was heart transplants. Mm-hmm. They had been doing it for close to 20 years, and we actually did 20 heart transplants in the academic year that I was there.
Okay.
And I noticed early on that we had a couple patients that came in, teenager and early 20s, that just stopped taking their medications. And there were concerns about compliance and medical adherence. So I talked to one of my attendings. I said, we need to understand this better. And how can we help these patients, making sure they get their medications and give them the resources available? So we looked at all of our transplant patients and seeing if there was a correlation between compliance and outcomes. And we started this, we're still working on this study, but we found that if you didn't show up to appointments, at least 95% of the time, you were at risk from not surviving after your transplant. So now we're looking back at the data more intimately, trying to decide or trying to look for what are the specific appointments that they're missing, and how can we help them get to those appointments, and whether it was before transplant or after transplant, and what can we do to help modify that risk factor.
Yeah, well, that's the type of research that we love to fund, and I often explain to people that Children's has a lot of translational research, and I explain that as a layperson as research that's dealing with patients versus bench research that's really important, but this is maybe a quicker result and to help patients quickly. And so I know that that's an important reason why someone like you is at Children's Hospital Michigan. You can take care of patients, but you're also thinking about what else you can do as it relates to the future. And so I want to thank you for all you're doing at Children's Hospital and for coming back home in many ways. And we look forward to having you back on the show and after a while, and you can talk even more about the great things that are going on in your area as well as the entire Children's Hospital of Michigan.
All right, thank you. I appreciate it.
Thank you. That was Dr. John Dentel, thoracic and pediatric surgeon at our Children's Hospital of Michigan. And coming up next, stay tuned as we cover current events of the foundation, some exciting things happening during the holiday season, and most importantly, we're going to recognize this month's Little Champion of the Game, sponsored by our partner, Northwestern Mutual. That's when Caring for Kids continues here on the great voice of the Great Lakes, News Talk 760 WJR. Welcome back, everyone. A great show tonight. It's always fun to have people in the studio, and tonight we had all of our guests in the studio, so thanks for joining us. And I want to tell you about some things coming up that involve our foundation. On Friday, November 30th, the Mid-American Conference football championship game will be played at Ford Field. It's our second year of being a sponsor of that. And the best part of that is allows us to bring our little champions out to the game, and they're on the field, they're on the big jumbo screen, they're all over the place. It's a great experience for them, and so that game is live on Friday, November 30th on ESPN. And so watch that show and watch our little champions. Also, it's the holiday season, and holiday giving is important. And if you're interested in a donor advised fund at our foundation, then just give me a email or a call. We're big into donor advised funds that give you the opportunity to make a contribution and then determine who you want to support. And so also in December, early December, we have a bobblehead night at Little Caesars Arena with the Red Wings, and that's to benefit the Jamie Daniels Foundation that we partner with in raising funds to help the opioid crisis. And then we have several what we call Shop for a Cause, so you can buy some great gifts for others or yourself, but also help our foundation on December 12th at Shinola. At their flagship store in Midtown Detroit from 6 to 8 p.m. Drop by Shinola, have a glass of wine, have some cheese, and also buy some things for your family and friends and help the foundation. And then on December 13th at Somerset Mall in Troy from 1 to 3, our partner Vineyard Vines will be allowing us to receive some funds from your sales. So most young people and others like Vineyard Vines, so it's a great place to buy Christmas gifts or holiday gifts. And then Chipotle Mexican Grill on December 29th from 4 to 8 p.m. Are also involved with Shop for a Cause. So that's all to help our foundation. And so I also want to, at this point, talk about the Little Champion feature that's sponsored by Northwestern Mutual. The Little Champion program honors children who have overcome major obstacles in their young lives, and they continue to tackle these challenges with a smile each and every day. This month's Little Champion is 9-year-old Rebecca from Rochester Hills. At 7 years old, Rebecca was diagnosed with juvenile arthritis in her knees, the most common type of arthritis among children. Rebecca's condition caused great pain and limited the mobility in her legs. But today, with consistent treatment and hard work from the great staff at Children's Hospital of Michigan and Rebecca's condition is manageable, and her discomfort has decreased significantly. She can now run, she can jump, and show everyone that there's nothing too hard for a little champion to overcome. Congratulations, Rebecca, this month's Little Champion. For more information on the Little Champion program and how you can nominate a child, visit chmfoundation.org/champion. So I want to thank you for listening to Caring for Kids. I hope everyone had a great Thanksgiving, and I hope you all have a wonderful holiday season, and we'll see you next time. Indeed.
Caring for Kids on WJR has been presented by the Children's Hospital of Michigan Foundation.